So tell us a little bit about this commercialization journey. You kind of told us a little bit about your background and how you got started, but what do you think, kind of as you reflect on that journey, what do you think are some of those key decisions that you made that have led you to the success that you're experiencing today?
Yeah, we were fortunate that a lot of really sharp people did some very wonderful work in front of us to develop the model we use today, which is called 𝘁𝗑𝗄 and so we knew this model was a good platform to start with. I think where we garnered some initial successes, we didn't initially look at it from a therapeutic perspective. We looked at it from an operational perspective to kind of figure out, what are the challenges we're going to face with scaling this model. And specifically, we looked at the provider base. And very quickly, we identified that there was a systematic issue when it came to we'll call it therapists or social workers, which is, if you look at that subclass of employees, these folks are typically the most compassionate folks you will ever meet. They've made sacrifices economically to take on the positions that they take on because they genuinely care about people. And then we as a system, what do we do with these folks? We give them complex patient caseloads. We overwhelm them and we burn them out. And so turnover in these two subsets is very, very high. And so we very quickly identified the need to look at how we would pursue employees or future employees, and then ultimately support them throughout the employee life cycle. And so, we tell a lot of people that we are an organization that's provider focused, which is a little bit different than what you hear in the healthcare. You hear a lot of we are a patient focused organization. Now we care dearly about the patients we serve. But we just feel like if we attack it from a different angle, which is let's identify great people and bring them in the organization, and then let's support them both personally and professionally. And if we develop these folks along the way and they're healthy and they're happy, guess what? The product and the therapeutic interventions they put out are going to be high level, and we're going to deliver good patient care as a result. So we just always knew that was going to be a core focus, and we built that into our culture. And so that's put us in a position today where it's a very competitive landscape to hire and retain social workers and counselors. And, we're viewed as a good place to work, which is nice. And so I think that is one of the most important aspects of our journey is that, we can do all of these things from a workflow and an efficiency perspective and from a financial modeling perspective. But if you can't go out and hire good people and then keep them, you're in a bad spot.
Yeah.
And so really,
always.
It's a key part of our growth, our growth story.